Hi guys, my name is Chelsea Barth, and today I'm going to be talking about Lewy body dementia. So the learning objective for this video is to be able to describe the prevalence, physiological basis, symptoms, and treatment for Lewy body dementia. Lewy body dementia is a progressive neurodegenerative disease that interferes with normal functioning. It's the second most common type of dementia, with Alzheimer's being the first, and it accounts for about 25% of all cases. Caused by the accumulation of Lewy bodies in the neurons. That's this round thing here in the middle. We talked about those when we learned about Parkinson's disease in class, and there's actually about an 80% comorbidity between Parkinson's disease and Lewy body dementia. So it's more common in men than in women. Prevalence among the general population is around 5%, and the rates increase as people get older. There's no single test for Lewy body dementia, and as a result, it is often misdiagnosed or undiagnosed. Symptoms usually begin after the age of 50. The average age at diagnosis is 76.3 years old, and then death usually occurs 5 to 8 years after onset. The only for sure way to diagnose Lewy body dementia is through a postmortem autopsy, but these symptoms can kind of point towards a probable diagnosis. So you have to have central symptoms, which are progressive severe dementia that interferes with your daily life, and deficits on attention, executive function, and visuospatial tests. You need to have 2 of these core symptoms, so those include fluctuating cognitions, recurrent visual hallucinations, and spontaneous Parkinsonisms, which are just the motor symptoms of Parkinson's disease. So slow movements, tremors, rigidity, difficulty initiating voluntary movement, that kind of thing. These suggestive symptoms are things that can point towards Lewy body dementia, but they have to be combined with these core symptoms in order for a diagnosis. So the physiological changes of the disease are all based around the accumulation of these Lewy bodies in the cells. They start in the dorsal roots of cranial nerves 9 and 10 in the surrounding areas down here in the brainstem. They then move rostrally through the brainstem up to the substantia nigra and the basal ganglia, which is why you see a lot of movement issues. From there, they move to the limbic system, which causes emotional issues. And then from the limbic system, you can see here they move throughout the neocortex, and that's where you start seeing the cognitive disturbances. Wherever these Lewy bodies accumulate, you see cell death. Neurons that release acetylcholine and dopamine are especially vulnerable to this. The cholinergic neurons are responsible for changes in cognition and memory, and the death of the dopaminergic neurons are responsible for the behavior and sleep changes as well as the hallucinations. So, like I said, we learned about Lewy bodies with Parkinson's disease. So they're basically these circular structures. The center of them is made out of abnormally folded alpha-synuclein protein that clumps together. In normal cells, the functioning of alpha-synuclein is not totally understood, but it seems to play a non-essential role in synaptic transmission. And then wherever they accumulate, like I said, they cause cell death, likely through the degradation of mitochondria and nuclei of the cell. So causes, Lewy body dementia can either be genetic or it can just happen sporadically. The GBA gene and this APOE gene have both been linked to Lewy body dementia. The APOE gene is what we talked about during Alzheimer's disease, so it's the same idea that the E4 allele is often seen in those with Lewy body dementia, where the second version of the allele, which is the least common, might actually be a protective factor against the disease. Sporadic Lewy body dementia is much more common than genetic. The biggest risk factor is age. Diseases like Parkinson's disease and REM sleep behavior disorder can also lead to it. But there's no association between someone's lifestyle and developing the disease. There's 7 stages of the disease. They're kind of a continuum as symptoms progressively get worse. There's not really a clear-cut barrier between symptoms, but once people get to stage 6 and 7 where the symptoms get really severe, they only spend about a year in each of these stages. So once they get severe, death comes pretty quick after. So you can pause and read through this, but you can kind of see how the memory and the cognitive stuff go hand in hand with this disease. For treatment, it really revolves around improving symptoms. There's no way to stop or reverse the progression of the disease. Acetylcholinesterase inhibitors and L-DOPA are both agonists for acetylcholine and dopamine respectively, and those kind of help combat the loss of those neurotransmitters as these cells die. Memantine is actually an MDMA antagonist, and it blocks glutamate and improves some of the cognitive issues. And then therapies, occupational, physical, speech, that kind of thing can help. But like I said, nothing can reverse it. This is all just kind of mediating symptoms. If you guys are interested in learning more about Lewy body dementia, here's the sources I use so you can go more in depth. I hope you guys learned about Lewy body dementia and that you have a great evening.